October is Breast Cancer Awareness Month, and joining us in the studio this morning for our medical interview is Dr. Lindsay Prochaska. So it's great to see you this morning. Thanks so much for joining us. We've been aware of breast cancer and breast cancer awareness. It's a message that we've sent for years now, and the message is getting out there, but there are still across the country hundreds of thousands of people being diagnosed with breast cancer. As a doctor, what is the main message that you want to get out to people so that we can lower those numbers?
I think the biggest thing is really just making sure that women are getting their screening mammograms. I think it's the biggest thing that we can do impact-wise to catch the breast cancer early and make sure that we can act on it.
And there's some as well as there's some information you need to know as a woman to get those mammograms, because there's the general population who may not be at risk, but then you've got an at-risk population. So the age to get that mammogram, it's different for different people, right? Right.
I mean, there are actually varying guidelines, whether it's your GYN guidelines all the way up to the National Cancer Guidelines. I would say, if you don't have a family history, you kind of fit into that at least starting by the age of 50. If you have a family history, though, you really need to be talking to usually either your primary care or your GYN to make sure that, if you're at risk, you're getting them a little bit earlier.
Yeah, and you can get lots of really useful information from your GYN. It's shocking to me. I talk to so many friends who don't even get that annual exam, and that's really sort of your first connection, right?
It is. It's a really good place to start. They've got great resources, and they're kind of your first line. They're the doctor that a lot of times we're going to as females. So good things to ask for them. As
you're talking to women who might come to see you, what's the main reason that they're not getting their mammograms? Do they ever talk about that, or?
I think time constraints, things like that. I mean, there's never really one reason that people don't seem to get them. I think, the best thing we can do too, make sure that you have our numbers, our website, especially at New Hanover. There's our central scheduling and things like that. You can just call directly with a screening mammogram request as well. So just us trying to do the best in making awareness of how to get in touch with someone to schedule.
And if you think it takes a lot of time, it is so quick. I mean, I think I've been in and out in 15 minutes.
Right.
And the great thing is that the 3D mammography is really helpful now too. Right?
Yep, 3D mammography, is more, cutting through, giving you a little more defined views of the breast. So yes, definitely very good in ways that we can keep advancing and finding these early cancers.
Yeah, more dimensional, so that you can kind of see exactly what's going on.
Right.
It's mammography's the mammograms are definitely the way to go, and they do not take a whole lot of time.
Exactly.
Right. Well, hopefully we've made a difference this morning, so
Absolutely.
appreciate you coming
Everyone
in.
get your mammogram.
Thanks for coming in.
Thank
Appreciate
you.
it. All right.